The following segment sponsored by RNA Medical Aesthetics.
We are on location today here at RNA Medical Aesthetics, their Abingdon office today. Of course, we're joined by Dr. Reddy, and we like to say Mr. Dr. Reddy. Thank you so much for having us out.
Thank you for being here, Amy.
This is a beautiful location.
We love it. We've had it for about 3 years now. We've been here for 3 years, initially in the next door location, but then moved in here, and it's turned out to be a beautiful space, and we love seeing clients here.
Yeah, treating patients from all over Southwest Virginia and talking today about such an important topic. We hear about it a lot when it comes to women's health and men's health. We're talking about perimenopause, menopause, hormones, a lot of information when it comes to those conditions.
Yes, so the hottest topic in women's health and men's health is perimenopause and menopause. And what I would like to emphasize is the importance of addressing hormone replacement therapy in perimenopause in the mid-40s, so you don't end up with delayed symptoms which start about 10 years before you really hit menopause, specifically for bone health, heart health, and brain health. So that's why it's so important to address it in the mid-40s, so when you do reach menopause, your hormones and your bones and your heart will thank you.
And you said too, same when it comes to men. They start losing some of what they're supposed to have.
Lots of times men, their levels may be normal, but they're not in the optimal range. So it's very important that we treat men for long-term benefits of heart and bones and energy and libido. So it's important to replace those hormones, especially the testosterone, even in women too. So
so checking levels and follow-up if we treat is the most important thing. You can't just check levels, replace, and not check anything for a year. It's very important to keep up every 3 months and adjust dosing based on how they're doing. And also the supplements part is very important. So as far as the importance of perimenopause is, people have symptoms that they feel like night sweats and anxiety, and but there are symptoms that are going on inside, changes in your bone and cardiovascular system that you don't feel, but they hit you in menopause where it's too late. By then it's too late, so we have to address it. To prevent osteoporosis for women is extremely important. And cardiovascular disease is #1 killer in women. Most of us don't know about it, and they don't have the symptoms that normally men have. So that's why it's so important. Perimenopause is the most important time of a woman's life.
And so that's the first thing really that you do when you come in, is get that blood work so you can develop that plan from there, find out where their levels are so you can adjust for both women and men.
Absolutely, and it's very important when you check the levels, because if you're in perimenopause, you're going through these highs and lows. So you've got to understand exactly what time you have to check them and then follow up.
And you mentioned supplements, and I know that's really important, but it's not just the supplements. There's the ways that we're taking them and how we're taking them that are making such a difference.
Absolutely, and let me give you, for example, vitamin D, a very, very important vitamin that's the only vitamin our body doesn't make. And a lot of people take them without checking levels. We don't know where they are to begin with, and what time to take them, and what company. A good brand is very important. Not all brands are the same. And also it's important to include K2 with the vitamin so that it gets into the bone and not just be in your serum. So to take full advantage of any of the supplements or vitamins, you need to know their mechanism of action. So that's why it's so important to take them correctly, the right time, and the right dosage. And then recheck levels. Again, if you don't check levels, you don't know if you're absorbing anything of what you're taking.
And of course, relationships, building that relationship with your clients who are coming in over time to give them that optimal health. What are you seeing as a response when they start getting everything in line and start to feel better from the inside out?
Sure, yeah. We try to individualize these treatment plans. Everybody is different. Everybody functions differently. So we try to individualize these treatment plans, and then when they do definitely give compliments from how they feel, and
They say we feel normal again.
Yeah.
That's the
I
biggest
didn't know
thing.
that was possible.
I know, they say this was how we were supposed to age, but they don't realize we don't need to be aging that way. We can optimize all systems at a cellular level, and they can tell the difference as soon as within 3 months, some may take longer, but that's what they say. I feel normal again.
Yeah.
Yes, we have seen some changes in some patients that we have within few weeks, but usually it takes few months.
Yeah.
That's what we tell everybody, that you have to have patience. This is it's not a quick fix. It's a long-term
Journey and a commitment
To good health.
to take ownership of your body and of your health, and that's what you got to commit to.
All right, well, we're going to give everybody some information, important information today for your health and wellness. If you would like to set up that consultation, of course, you can get a hold of them by checking out their website. All of their products and services are listed at rnamedicalaesthetics.com. You can also visit their offices here in Abingdon or in Johnson City.
The preceding segment sponsored by RNA Medical Aesthetics.